Hello, good morning. I hope you're able to hear me out. If you're not able to hear me, just send me a message, please. Okay, somebody says it's audible. Thank you very much. Good morning, everyone. So, sorry about the inconvenience. I'm showing you a reflection of a parallel monitor. Since I couldn't share the screens, I thought it was better to share the screen and take you through what I want to say today rather than just narration. Um, so once again, good morning to everyone, and thank you for inviting me to give a talk on COVID-19, facts, fears, and future. I especially thank Professor Roshan Farouk, my guru as well, who invited me to give this talk. So without much ado, I'll just go with the presentation. So today, as I said, I'm going to talk about COVID-19 facts, fear, and future. Just going through the introduction of coronaviruses, it's a large family of viruses that cause illness ranging from common cold and severe diseases like MERS and SARS. These are RNA viruses and highly mutatable. And these viruses are generally zoonotic, as in they are transferred from animal to humans, and that we've seen with SARS and MERS. So COVID, as we call it now, was actually initially called as SARS-CoV-2, which refers to a severe acute respiratory syndrome, coronavirus 2. And now it is called COVID-19 post 11th of February by WHO and FAO. It's a very interesting virus. So this one is called corona simply because the receptors look like crown, and hence it's called coronavirus. So I am sure you guys have already seen a lot about how this coronavirus, the COVID-19, behaves and how it infects. And I'm sure you're all an expert at the moment. I'm only summarizing what you have already seen in the media or read in the media already. I'm just making sure that I'm just summarizing all these things from a scientific perspective as much as I can. At the same time, I'll keep it as simple as possible. If there is anything, please do ask questions at the end of the presentation so that I can answer one by one. So going forward, the clinical symptoms. So this is a general clinical symptom which looks like any normal flu, with fever, cough, fatigue, shortness of breath. But again, in the government of Karnataka, rather ICMR's perspective, they're all divided into different categories. So the category A is where you have primary contact, secondary contact. Category A and B are generally 1 and 2 is generally primary and secondary contact. And category C or 3 is generally with regards to travel and then usual community screening. So that is how we have been classifying the cases which are coming into our labs. So here at IISc, we do some bit of testing, and we are contributing at least about, we're taking quite a bit of load at the moment because the number of cases in North Karnataka are going up. So we are a designate ICMR lab, and we were mandated to run the test here. So I'll go into more details about testing later on. So next, going forward, we look at the transmission of this virus. This is a typical coronavirus RNA virus transmission, wherein it binds to the ACE receptor and then goes on to, one second, where's my mouse? Okay. Yeah, so then goes on to the virus assembly, then you have virions, and going forward you have all the immune, it goes and binds to the T helper cells, come and get your immune system running and goes on. It's a typical RNA virus, as I said. This virus generally takes over the cellular divisional mechanism, and then starts assembling the virus and producing virions. Further to which the immune response from the T cells kicks in, and then is the B cell and the cytotoxic T cells come in. So how is it transmitted? This is the virus. Once it enters the body, this is the mechanism in which it goes about infecting the rest of the body. But how is it transmitted? It is generally person to person, and then the contact with infected surfaces. Now, when I say contact with infected surfaces, there are a lot of misinformation amongst the public. So I've heard a lot of friends who have stopped getting newspapers, thinking that somebody sneezes or coughs on top of the newspaper, and some article which has said that corona is live on the surface of paper for about 8 hours. People have stopped getting newspapers. People have stopped getting, once they get the packet of milk, they wash it with hand sanitizers or hand wash, and then start using. These are all good. Washing milk packets, vegetables thoroughly is good and hygienic. But at the same time, I think it's an overkill. What has to be kept in mind is, once you touch these surfaces, you shouldn't be touching your face, nose or eyes or ears, which is the main passage for the coronavirus to infect you. So in future, make sure that you are making sure that everything is washed and clean, but at the same time, wash your hands. And as soon as you touch your newspaper, there is no need to take extreme decisions of discontinuing something. Next is the aerosols. Aerosols is through, generally, when it is in a normal setup, it's like through coughing, sneezing. You create a lot of droplets which have virus, and then that enters the that enters the body and infects you, basically. But in the health worker perspective, when you have the tubes or anything, so we have, I'll go further on, I'll tell you how we do things. I'll play out a video for you where we inactivate virus and everything. But right now, all I can be saying is, when you have the VTMs, which is the viral transport medium, wherein you get the swabs into the tube, we take care that the tubes are not shaken, there are no bubbles are formed, and all the tubes are opened under a BSL-2 cabinet, because there are a lot of aerosols, and even with your N95 mask on, there are chances of you getting infected. So aerosols is the main or the most dangerous way of getting it. That is the most dangerous way. That's the most dangerous way to get infected. That is one thing that you have to take care. So when you sneeze or anything, cover your nose, wash your hands, sanitize your hand, and you are done with it. So what is the diagnosis that we have at the moment? So we have X-ray, CT scan, which is a general one. We have antibody test and qPCR. At the moment, with the ICMR guidelines, we are not doing much of chest X-ray or any of the CT scan. This is more of a academic interest that we have. People have done it and seen what is the morbidity of this or pathology of this infection in the lung, since it's respiratory infection. So I'll go more in detail into each of these going forward. So this is just on the left, you see a X-ray scan of the lungs, and you can see the ground glass like opacities. And on the right is the CT scan, which again it is confirming the X-ray scan as well. So this is the antibody test that that has been used for a long time now. So we have, this is a very straightforward test wherein you either take the plasma or your blood, and then put it onto a small strip, and then you get these bands once you run it. It's like a filtration system, like a chromatography, which runs the sample through, and you can develop. These are like your pregnancy test strips. So based on the bands that we get, we assign it as positive, negative, and invalid. Um, the good thing about this is that it is very quick. So it happens you can get the results in minutes. Plus, it is also very cost effective, and you don't have to go around uh, transporting the samples far away, and you don't need to worry about viral disinfection or any of these. You just need to take a drop of blood, and then you just run this, or a drop of plasma. So what happens in this system is that the antibody IgM and IgG, there is a protein which binds to the IgM IgG, that is on the filter paper, and then that the antibody goes and binds to these and gives out these bands. A typical, as I said, it's a typical pregnancy test strip. The same principle happens here as well. But the problem for this one was that in this thing, we can actually look at community transfer, community spread, and you can test a large number of people at one go. However, the reason for this not being implemented in full scale is because of the non-specificity of the bands that you start getting, because these proteins that are there on the filter paper to bind to IgM and IgG are not very specific. So non-specific binding happens, and then you could get false positives or false positives more. So the positivity rate in this one, the specificity, rate is about 50 to 60%, 50 to 70%, in fact, in this case. But the advantage of this antibody test is it's historic, as in, even if you have an infection, if you had an infection about 2 months ago or something of that sort, the test can still pick up your antibodies and say that you had an infection, which is a good thing that you get to test the community transfer. And then it is the same for even if you have a active infection running. So you'll have antibodies and you test it. So that way, this is a very, but there was a lot of logistical problem in this, in implementing it in India, since we hadn't developed it as ourselves. And as I said, there was a problem with the specificity of the protein. We started getting kits from China which didn't work properly. Everything failed, and the government shut it down. But recently, ICMR has come up with a good kit which can detect, which is quite specific. And also we have another tie-up with the Korean kit, which is called SD Biosensor. So these are some of the kits which are new and which seems to be promising. But the time is only the matter that we'll have to see how this can be implemented in the large scale. So this is going back to the same slide. Sorry. So this is what generally a lot of people used to do, and this is what we do: qPCR based testing in our lab. So this is at the moment the gold standard test for COVID-19 infection. The problem with this is, I'll go with the problems and then deal with the positives of this. This takes a long time. So if you have one sample, if you take one sample through and through, it takes about 4 to 5 hours to get your end result, and that is if everything runs fine. And the second thing is the cost of it is way too much. So each test, government had put in a cap of 4,500 per test, but that cap is far too low. As we see, we're a government institution. All our kits, all our PPEs are being given by the government. So we are only spending on our plasticware and lab wares and the rest of it. But however, even calculating based on the cost at the moment, it is way higher than 4,500 that each test costs. So that is one primary problem with this qPCR, but it is very specific. We know that it works, but again, it is time consuming. And you might have all read the reports about tests are taking far too long and we are not getting results on time. So that these are the some of this is the problem with qPCR, that sometimes you get everything at one go. Sometimes your negative starts picking up, sometimes the positive doesn't come up, the controls are not working fine, so you'll have to repeat the whole thing again. So that takes time, double the time than what it actually has to. So going briefly about how this happens is the uh, sample collection, which happens the nasopharyngeal swab, and the swab goes into the tube, which is the, you see the pink medium here, which is called the viral transport medium, which has, if it is infected, has the virus. So then we do a lysis of this medium, break down the virus RNA into pieces, and then go into purification of this virus, and then we put it for, so here I put it in two different steps, but it is actually, as you see, this 3A and 3B, it happens in one tube. As soon as you put RNA into the tubes with the probes for any of the genes, then they start synthesizing cDNA. Going forward, the primers bind to it, and then we get positive or negative. I'll show you the graphs for this. So I don't know if you can see properly. So this is a very faint graph. So on the left is a negative graph where, two genes that we're checking, both are negative, and it's perfectly all right. This patient is negative. Whereas on the right, this is a perfect positive case where both the genes have come up. So this shows that qPCR is quite sensitive, and this is again at this moment, all this qPCR test that we're doing is only qualitative, as in easy person present, is the person positive or negative. We're not going into the quantitative, as in the viral load, like you might have heard for HIV testing, where they give you what is the number of viruses per millimeter cube, calling as viral load. Here we haven't got to that stage yet, because that again takes more time to standardize and everything. So at the moment, everything is running on emergency, and we want the test results yesterday. So we run with it. So we're just doing a qualitative analysis of this. So as I said, I told you I'll show you a few things about how we don up and other things. So this is our friend Srivatsa, who is completely donned up to get into the BSL-3 facility before to inactivate the virus. Just hold on a moment. I will play this video for you, and let me see if I can get that sorted.
The biosafety level 3.
Sorry, this is taking. I have to go on the opposite direction. Okay. Okay. So this is the
BSL-3 is a containment facility located in the Center for Infectious Disease Research building. It is used for carrying out associated research activities involving airborne pathogens such as Mycobacterium tuberculosis and other human pathogens including HIV and Salmonella. Restricted access to the BSL-3 is ensured by a biometric system. The BSL-3 has special safety and engineering features for maintaining requisite negative pressure environment to ensure unidirectional airflow and for ensuring safety of lab personnel and the environment surrounding the lab. All personnel must enter the BSL-3 through an anteroom after donning protective gear in the following order: one pair of colored nitrile gloves, a surgical mask, headgear, shoe covers, an N95 protective mask, and a Tyvek jumpsuit. A BSL-3 laboratory has special engineering and design features. It is designed in such a way so that it can be easily cleaned and decontaminated. All procedures involving the manipulation of infectious materials must be conducted within biosafety cabinets or other physical containment devices. Laboratory furniture is capable of supporting loads and uses. Incubators are to be kept clean at all times, with unused cultures disinfected and discarded as soon as possible. A BSL-3 technician is responsible for transporting and autoclaving the waste. Waste is autoclaved once or twice at specified times of the day depending on the use. Before starting work at the biosafety cabinet, turn on the blower motor and allow it to run for 3 minutes to fully purge the contaminated air from inside the cabinet. Cover the inside surface of the cabinet with absorbent pad so as not to obstruct the front or the back grills. The items used inside the cabinet can be removed from the biosafety cabinet by first wiping off the surface and then the item with Lysol. The item can then be placed on the clean surface. The investigator should remove the dirty gloves, wear a clean pair of gloves, and then remove the item without touching anything else inside the biosafety cabinet. The biosafety cabinet should be wiped first with Lysol and then with 70% ethanol before and after every use. Switch on the UV light after use for surface decontamination. The animal room within BSL-3 has specific animal cages for experiments.
So yeah, that's the inactivation that we do. And going back to the presentation, so but the difference between what I showed you as a BSL-3 video and what we do here, there's a slight difference. This is a TB facility in the first go when it was opened, but you see that there are Srivat says done 2 PPE suits at the same time, because that requires double PPE, whereas in TB it is just single layer. This is double layer, N95 mask, hood completely, shoe covers, triple layer gloves, and then people go in and work and inactivate, and then comes the visor or goggles depending on one's comfort levels. So we have a lot of safety features, safety rules that we need to follow before we can get in and start handling this. And especially at IISc, the safety standards are maintained to the highest level possible. Each place have their own safety measures, and this is what we do here. And what is the treatment at the moment? There is no specific treatment currently available, as there are no specific antiviral virals available. Mainly it is clinical management, which is recommended, and prevention of infection, and control measures, and supporting the management of complications during the course of treatment. But there are a few drugs which are already used for treatment, which is hydroxyquinone. I'm sure you guys are all knowing about this, and there was a big talk and controversy about usage of hydroxychloroquine, which is an anti-malarial drug, which is an against COVID-19. Then there is the favilavir and remdesivir, where they have already used, where they're trying to run a trial to see if it makes alleviate the infection better. And in the UK, they had already used dexamethasone for people who are in extreme when they are hooked onto ventilators and other things, on life support. Basically, they are given dexamethasone to revive them from the infection. So, how do we prevent? This is something that we already have seen. I'm sure every time that you pick up your phone and then start dialing somebody's, and you start getting the voice message saying what has to be done. How do you deal with COVID? This is just a affirmation of what they've been saying. Initially, WHO had said that people who are infected alone have to be wearing masks, but later now it has changed, because what has changed is there are most of the people who are positive are at least in India are asymptomatic, as in they don't have symptoms, and then they don't show up any symptoms. So that's the reason why we wouldn't know who is carrying the infection, who's not. So on a safer side, everyone wears masks, use hand sanitizers. Basically, what it is reiterating is personal hygiene is of main focus here. And of course, rest and keep yourself calm, which is the main thing that you need to do everywhere. And the other thing, of course, is I'm sure you guys are already aware about the social distancing. Please be don't have physical greetings, and don't do physical greetings. Don't roam around unnecessary outside as far as possible. Isolate yourself, and especially who are elders, try and restrict them at home and not allow them to roam around when the cases are on the rise at the moment in Karnataka as well. So, what is the impact? So, there is, of course, for every infection in India, there is a social stigma attached, and people take extreme measures, even though COVID-19 infection can be dealt with treatment and proper care. People don't realize it. There's a lot of misinformation, and people take the extreme steps of committing suicide or any of this sort. So that is something that will go on for go away in the long term, as in when the disease progresses. But at the moment, I think being me telling people about, I keep telling people that this is something that can be dealt with, especially people under 50. And people above 50 with comorbidities have some probably go into complications, but again they can be treated. If not, they don't need to go in for an extreme step of anything. Then what is the other impact that we seen everywhere is the economy. Economy has taken a blow completely, and everything is going haywire, and the government is trying to revive the economy. This keeps running on the news channels every minute as you switch it on. So what is the new business model that we are seeing? So the thing is that we were one of the last ones in terms of the PPE. You might have read about the PPE shortage, scarcity that had happened, and we were all dependent on China for all our supplies. Now, apparently, I was speaking to a few of the suppliers that we have for our facility. All of them say that India is number 2 in supplying PPEs for the moment, and as soon as the export gates are open, I think it will be one of the biggest business that has to happen. Every gene manufacturing company has switched to PPE manufacturing, and a lot of kits are being developed. A lot of ways of treatment for this infection is under development. So there are a lot of things which are happening in India alone, and new things are coming up. So one way to look at it is the general economy is going down, but again, there are other things which are propping up with our own self-sustenance and company who are self-resilient as well coming up in India. And because of these misinformation, there's a lot of panic, of course. And as I said, there is no need to panic. We deal with where there is information, whether you know how it gets infected, and taking care of those points. I'm sure you can you can be safe and not get infected. The other major thing in terms of research and academics is that during Corona, what we're seeing is this is one of the one-off situation. Of course, this is a one-off situation with pandemic, and we haven't seen this in ages. With all the technology improvement as well, we're communicating with each other. We have a scientific portal called PubMed, and none in. I've been in science for about 12, 13 years, and none of the time that I've seen, even when there was worse infections like SARS, MERS, MRSA, and other things, nowhere did I see PubMed creating a tab for COVID-19 alone. So you can see how much of importance is given to COVID, which is a good thing. I'm not saying no, but there are other infections for like which are endemic to India, like malaria, TB, some HIV, HBV, HCV. So all of those infections have been sidelined at the moment, and everything, the money is going only to COVID-19 and its own vaccine development. I see that a lot of people say that it's something that is killing a lot of people. So obviously the focus has to be on that. But I would say that that is fine. But I think we should also concentrate on other infections, other problems, other lifestyle disorders that we have in India, like diabetes and heart problems. And the most now peaking is the dengue fever and normal flu, seasonal flu as well. So I think government has to concentrate on those infections as well. So going forward, what is the thing that they're going to do? So there's vaccine development. I'm sure you guys are reading up about it, and there are a lot of companies telling we are almost there. In next 2 months, the vaccine is ready. 3 months, vaccine is ready. And everyone that I speak to, and I say, "Oh, you are testing you're testing for Corona, so COVID-19. So what have you found a cure?" So people don't realize that this infection is only about 6 months old for us, and then getting a vaccine takes years together. There are so many infections, diseases like TB, HIV, malaria, where we still yet to find a vaccine for it, because it takes a long, long time. Whatever, even for TB, there is BCG, but the BCG is not good enough for it. You have the cover for first probably 20, 21 years, and beyond which you will have the same problem of reinfection or reinfection again. So vaccine development takes a long time because there are a lot of steps to be done, and then there are clinical trials take a longer time. The impact of each vaccine has to be tested, tried, tested again, and then only it comes out in the market. Anyway, going into that is the logistical problem. Let us see. Let us hope for as vaccine development as early as possible. So I'm just giving you a glimpse of what is happening or what kinds of vaccines are in the market at the moment. So there are viral vector vaccines, there are virus vaccines, and nucleic acid vaccines. So a viral vector and virus, even though they are virus which is sent into your body, they're really not the infecting type. So they create the thing for transportation. So here in the replicating viral vector, wherein they had weakened the measles virus and then sent it into the body for immunity. That has worked. There is non-viral, non-replicating viral vector. Now this one, this one here, it will replicate. This is a replicating virus, but here it is not replicating. But they haven't. No commercial vaccine has used this method yet. So then you have the weakened virus method, wherein India, I'm sure you have read about Serum Institute of India in Pune are coming up with this kind of virus. But I think, as I remember, they have not been successful, but they're seeing the immunity for flu. So they might use those for against flu infection. Then you have totally inactivated virus, where it's basically the virus is killed and you have just the as you call it, dead body of virus, which goes into the it's given to you, and you probably would develop vaccines. The other one, which is more happening at the moment, is the DNA RNA vaccine, wherein the RNA or DNA is encased in a lipid and then sent into your is injected to you, and you will get the immunity for that. These RNA and DNA usually code for the viral proteins. So there is an immune response which is elicited due to these proteins that are secreted, and so you get an immunity to this infection. So going forward, future again, vaccine development, and then this is the other one, the herd immunity. So if the vaccine development takes a long time in coming to market, then we'll anyway forced into herd immunity. Herd immunity is something wherein the population, at least about 80% of the population, is infected, and then the population itself develops an immunity to the infection, and thereby reducing the number of people for the virus to infect the rest of the 20% of the population. So that's one thing. But the problem with that is that you will have a lot of fatalities in this kind of herd immunity. And you must have read about UK, where it said that it wanted to go in for herd immunity and use that model for preventing COVID-19 infection. There was a lot of backlash for it. But I think with the present way the infection is going forward, I think we are forced into getting herd immunity, because vaccine will take probably a long time to come in. So as I said before, it is self-sustenance. Economic measures has to be taken. I'm sure Government of India has already taken the initiative and doing these things. They've taken it into their stride, and then they are doing whatever that they can to make India independent, and we getting our own stuff here for everything, whatever it is. The one point that I forgot to tell you is why is it that Corona or COVID-19 infection is so dangerous? So people say, well, it is the most dangerous one. Why is it that it is more dangerous? Why is common flu not so dangerous? Even though the symptoms and everything are the same as flu, why is Corona being rated as one of the most infective virus? So we have the epidemiologists do a calculation called R naught, which is basically the reproductive or the infective rate at which this virus can infect somebody else. What is the rate? So they scale it, saying so when you say, for instance, smallpox was R naught value was about 13. Whereas it was about, I think, 7 to 13, I think. And then the Corona has R naught value of 5.7. And then SARS, which is its predecessor, was about 0.13 to 1. So you can see that from SARS to this, there's a 5 times jump. And so people are worried because the infectivity rate is more. So one person getting it is equivalent to giving it to another 6. But this R naught value is not confirmed yet, but this is a tentative one since we are still going through the pandemic. But that's probably the reason they might change the number, or the change number might get changed. But as of now, it is around 5.7. So that's the end of my talk. Thank you very much. I hope you have enjoyed all the. I have informed you a little bit more than what you already knew about COVID-19. So stay safe. And then, okay, I think I will move this around to show my face finally. You've been seeing Corona a lot now. Let me show you my face. Yeah, so finally, thank you very much for attending this. There were a lot of people attending. Any questions, please do send me a message on WhatsApp, and then I can answer it for you. If you have any questions, put it into the comments, please. I will try and answer if there is any. Yeah, so our friend here, Badri Rajgopal, has sent a question saying, was the lockdown lifted too early? Probably the lockdown which has happened in India, there is a problem of infrastructure, medical infrastructure, which is lacking big time in India. I think the lockdown was probably for getting the infrastructure right, but we are still finding it difficult to meet with the demand at the moment. I'm sure there's some talks about future lockdowns as well, but I'm not sure about it myself, or there's no news about it, but there's talks about it. So the lockdown again might help, might not help. I don't know, because the infection is still something that we need to learn more about it. So I'm not sure. So, do ordinary masks help? This is Mr. Hussein who said ordinary masks. Yes, ordinary masks work because you are not exposed to anything. You're not working in an environment where there is where you're dealing with corona patients. So, I think that way it is fine. You can wear a surgical mask, but make sure that you change those surgical masks every day. If you're using a cotton one, please wash it and then. Use it regularly. I mean, wash it regularly and can use it. Well, viral transport medium is more or less you have some antifungal, antibacterial, and some fetal cough serum. I think this was from Mr. Ganguly. So this is a formulation which has antibacterial, antifungal, and some fetal cough serum which is transported, I think. Um, yeah, yoga prana is useful in controlling COVID. Yes, of course, any kind of breathing is good. Hmm? So any kind of breathing exercise is always good. So I think that should be a good thing to do. Well, mutation we are yet to see. We've already seen there are a lot of mutations. There's a lot of mutated subtypes which happens at the moment. Which has happened already at the moment. So we are not sure how quickly so we have a DBT 1000 genome project where they're getting all the genomes of viruses across India, and then we would be able to see and do an epidemiological study of what is the rate of mutation and how regularly does it happen. So there's another question from Miss Madhumita Ghosh. So she's asking, are asymptomatic infected are silent carriers? Yeah, silent carriers. Yes, they are silent carriers. They have the virus within themselves, and then they keep carrying it around. But I think they are even infective at the moment. I think WHO withdrew the comment about saying that asymptomatic patients are non-infective. So, what is the rate at which the samples are tested across India? Well, so this was from Ms. Sundararaj. So the rate of testing across India is at the moment 1.5 lakhs, and in state we are close to about 15,000-16,000 tests every day. Now, what is the use of testing? Well, we're testing and tracing, making sure that it doesn't transmit. But more often than not, we're seeing that there are contacts no matter what. It just kind of it just slips between your finger, and then you have positives coming up. Well, I don't know how long can a virus sustain on a particular surface. It varies from surface to surface, and then it can vary from about 30 minutes to I think 8 hours or something. I think that was something that was already published, and we are not sure of how things are now. Yeah. 11:54. What to expect in next? Where do you see this heading? Well, Mr. Moidin, I don't know where this is heading because we are seeing a rise in number of cases. So certainly we might start seeing more cases coming in. So there is nothing to fear about. I'm sure it's just like another common cold as long as things are taken care of. Um, yeah, I am not sure. We have to see for the next 3 months ourselves. Things are changing. The lockdown is removed, so the number of cases might go up. Shows corona positive but no symptoms. How is it possible? Well, your immune system is good enough where you are able to sustain or contain the symptoms, but you are infected. So that's the reason why you can still have the infection but not show the symptoms. Miss Sagarika, we don't know about the virulence yet because it's more to do. We have to wait to see how the virulence is. There are a lot of factors for the virulence. Dr. Shamanna, sorry, Shanma. There is a difference between N95 and ordinary mask. The number of layers is used and the material used is different. So zero point 0.5 micron filter, which is used in N95 mask, whereas in surgical mask, it's a 3-layer, I think, a cotton-based material mask. So that's the reason why I say that people don't need to wear N95 mask for your daily thing because it will suffocate you. Surgical masks are more than enough. We in our lab use N95 when we are inactivating virus. Common cold and fever, how to differentiate? Well, we can't differentiate. That's the point. So with the flu and coronavirus cannot be differentiated. That's where the main problem is. So you don't know who's infected with corona or who's infected with normal influenza. So that is something that is a problem. But when you go in for testing, if you have a influenza like illness, they certainly test you to check if this is corona only or COVID only. Well, it could be Miss Gangadhari. I think, sorry, Mr. Gangadhari. I think it is possible to grow virus without any symptoms. Yes, but again, it will take another 14 to 15 days for you to get rid of that. Yeah, cotton-based masks should be working fine, as I said. Yeah. Person affected in common will have symptoms like running nose. Is it applicable to corona patients too? So initially, when they said what are the symptoms for corona or COVID, they said you will have dry cough and then less of phlegm or mucus. But seems like there are enough evidence that it can be a flu-like cough, cold as well. So yes, it is possible to have cold and yeah, and running nose as well. Yeah. Sorry, Mr. Zai, what is ARDS? Mr. Ayappan, I think without medium, as I said, it could last between until 72 hours, depending on the surfaces that it is in. So it could last longer or less. As the virus mutates as well, we don't know the life of it on different surfaces. Ginger juice can control. Yeah, I'm sure ginger juice can do a lot of things. Why not? Anything positive you can take and make it better. That's it. I'm sure it is. Yes, Dr. Shrikant, hot water helps with everything, even digestion. So I think you can have hot water and also deal with cold and cough, and plus COVID as well, probably. Most of these questions, I know, I'm sorry, these are all naive questions that people are asking. I have no problem. I mean, I'm not making. I'm smiling because the comments are coming in such way. But anything positive to this? We only know so much. Whatever that I've told you is what we know so much about this virus. So as I said, we are only 6 months. This virus is only 6 months old, so we don't know about it. Baba Ramdev, I was waiting for this. Who is this? Miss Gay, Baba Ramdev medicine is effective or not? I am not sure. You have to ask him. Acute respiratory distress syndrome. Not sure about it myself. Sorry. So thank you very much. I'm now ending. Okay, last question. How often should we use sanitizer? I mean, there is no minimum number of times that you need to, but whenever you are touching surfaces that you think are touched by a lot of people, I think it is better to use sanitizer. But again, use it with a lot of care and caution, and then wash your hands before eating or anything with soap. We use sanitizer with care and caution because it's IPA, and overusage might be irritant to your skin as well. All right. Thank you very much, guys. Now I'll end the stream. I hope you all enjoyed the talk. Thank you. Thank you. Stay safe.